All right. Good morning. Welcome back to Live the Dream Media Network. Christopher DeSimone. You're on Wake Up with Christopher DeSimone. And we just got our Spotify Unwrap. Number one country, of course, is America. Number two country listening to this show is Lithuania. And it's something we talked and said, man, we need more Lithuanians listening to the show. And boom, we delivered. So let's go. We're doing like a first here. We got Dean Clancy, who is a health policy expert with Americans for Prosperity. Dean, good morning, my friend. How are you?
Good morning.
Now, what we're doing is we're holding over our previous guest because he wants in on the conversation. It's U.S. Congressman David Schweikert, who is he's a geek about a lot of different things. David, I don't know if you know Dean, but Dean?
I know of Dean, and I've actually read some of the things he's been involved in. So, hello, Dean.
Well, thank you. Hello, and Congressman, we have shaken hands in the past, but otherwise, I don't think we've met.
Okay, yeah, it's one of the hazards of what Dean does and we do, but in a weird way, those who actually care about the actual price and services of healthcare. You're part of a very small population, Dean. Everyone else is rent seeking and trying to, chase the money.
So we're in this interesting world, fellas, of, we had the shutdown. They talked, then we found out how many people are on all these different benefits. And then we're talking about the subsidies on top of subsidies on Obamacare. So we'll start with Dean. Dean, where are we at now, and how do we fix this mess? Because that's how I've been telling everyone. David, Dean, and Chris fix Obamacare all in 20 minutes. So start us off, Mr. Clancy.
Okay, well, of course, it took 15 years for Obamacare to really wreck our healthcare system, but it's done that. It's failed, yet the Democrats are basically staking their political future in the midterms on bailing Obamacare out or trying to blame Republicans for any disruption that comes when the extra subsidies expire on January 1st. They say it'll be the end of the world, but it won't. But Obamacare has made healthcare less affordable, and it's made it harder to see a doctor that you prefer. And it's, the insurers deny 20% of the claims that doctors file. So care is getting denied, and it does need to be fixed. And happily, Donald Trump, who was mocked for having no idea what to do on healthcare, having only concepts of a plan, well, he's got a plan now, and it's very simple. Fund patients, not insurance companies. He's called the Democrats' bluff here because Obamacare sends hundreds of billions of dollars every year to health insurance companies. That's how it's structured. And a lot of those people never see a doctor, never get a prescription filled. In fact, many of them don't exist, and some seem not even to know they've been enrolled in Obamacare. There's so much fraud. And he's saying, well, whatever we do, let's give the money to the patients instead, in a tax-free health savings account, and let them decide what to do with it. The doctors they want, the procedures they want. And it's a great idea. And at AFP, we're very excited about it.
So we're turning these folks into cash payers through health savings accounts? Is that what's going on?
Yeah, the idea is cut out the insurance middleman. Now, you still need insurance, and there would still be insurance in Obamacare and generally. In fact, to have a tax-free health savings account, you have to have health insurance. That's a requirement. But you get control of the money. Now it's not a stranger making decisions for you. It's you deciding on the care and doctors you want. And one nice thing about an HSA is you can get things that your insurance does not cover and doctors that are not in your insurance plan's network. So it's a lot more freedom and choice. And if you take some of the subsidies that we're currently spending to give people health insurance and just give it to them in an HSA, now you've made life a lot better for them, and including people who are very low income, very vulnerable. They can start to enjoy a healthcare experience that's more like the middle class.
Well, David, you've been watching this thing from the beginning, even the old days when John Boehner put you in a closet.
Yeah, it's like, and look, you don't need me. He got it right. And Dean, if you get a chance, 2 Fridays ago, my joint economic economist put out a paper going through.
Yeah, I saw it. Good paper.
Yeah, and the fascinating thing, we were expecting the Democrats and the left and even some of the insurance companies to come at us saying they didn't like our analysis, and no one has shown up with math or anything to disprove. But think about this. These are subsidies on top of subsidies that were meant to be temporary, coming out of COVID, and taking much higher income populations and subsidizing. We actually analyzed that if you do the economic effects, a third of this money goes has no association with healthcare. It either just disappears in the insurance company. It's the person who is insured has no idea that they've been signed up or insured. It is we're actually launching a series of investigations into the fraud that has now become part of the way insurance companies and some of these brokers sign up people in the ACA. But Chris,
Yes, sir.
how much of the healthcare population is actually on ACA, Obamacare? How much is it?
Of everyone that's in my
Everyone, from top to bottom.
9%.
7.
Oh, that wasn't bad.
But what we're talking about here isn't the 7%. It's the portion of, on top of that, they gain the enhanced subsidies. And this is part of the great fraud that's been discussed, is acting like this is healthcare. It's a fraction of the fraction. But it was in many ways the Democrats' big toe in the water of moving to a single payer.
Dean and David, why is sniffing out fraud a problem for some of our brothers and sisters on the other side of the aisle? We'll start with Dean.
Well, yeah, it's funny. Democrats don't seem to have see any problem with Obamacare or government-run healthcare that a lot more money can't fix. That's their only answer. That's their plan, is just spend more. And I do think the congressman is right. Their long-term goal is just to put the government in charge of everybody's healthcare, which to me is a little crazy. It's sort of like putting the Department of Motor Vehicles in charge of our healthcare. Do we expect to get healthier with that? But no, they're not interested in talking about the fraud or even pursuing it. It's finally Republicans are doing that, as the congressman pointed out. And just yesterday, the Government Accountability Office pointed out that you have hundreds of thousands of fake Social Security numbers being used in Obamacare, the same number being used dozens of times, 125 times. And so, of course, a lot of money is going out the door for someone who doesn't exist. Where does the money go? To a health insurance company. So the insurers don't have any incentive to police this either. So thank goodness for the Republicans looking into it. And hopefully this puts the nail in the coffin of the idea that we need to continue those extra subsidies.
Our computer systems are not picking up that there's the same Social Security number getting hit multiple times.
No, well, sometimes they miss it, and sometimes what they do is they say, well, we think there might have been identity theft, but we want to make sure the real person with the Social Security number gets enrolled. So if 125 people use that same Social Security number, they're going to hope there's one in there that's the real person. That's Chris, what they do now.
Yeah, I'm even more cynical than both of you. Fraud. Look, healthcare has become about one thing: money. Not about you and your family getting a cure or being able to take care of an ailment quickly and efficiently. The fraud is actually part of the business model. And I'll give you a simple example. We had one of our economists sort of do the analysis of what's the cost of duplicative MRIs, X-rays, CTs, ultrasounds to U.S. healthcare. And we have a number, it's from 25 to 35 billion a year in duplicative scans. We offer a piece of legislation saying, hey, when you get your knee MRI'd, that scan should just get attached to your phone and portable. So a week later, when you go to your doctor's specialist, you don't get scanned again. We get an army of angry lobbyists and come marching into our office saying, you don't understand the duplication, the waste is their profit model.
Wow.
And so there is a miracle of technology that could crash the price of healthcare. But the current way we finance healthcare actually stops the adoption. It's actually because we've turned healthcare into financing, not actually getting better. If you could become portable, just as Dean talks about, where you're making decisions where, because who cares most about your healthcare? You do.
Yep.
Government doesn't. The insurance company doesn't. Um, it just alignment of the incentives we believe could crash the price of healthcare.
So I got a question in the live chat from XTina99999. But the subsidies on top of subsidies are the only way to make it affordable for the middle class. It's a rig of the system, but it helped the middle class. What's your answer to that, gentlemen? Dean, you want to start off?
Well, yeah, I'll jump in on that. What the extra subsidies did is they made health insurance completely free for people who are rather low income, below 150% of poverty. So you're talking about maybe $20,000 a year. And but for people, it also lifted the cap so that if you make any amount, you could be a millionaire, and theoretically you can get a subsidy under Obamacare. It's sliding scale, so it does phase out. But really, the middle class that I think this person is talking about is people who are making maybe $90,000 a year. And some of them are going to see a jump in their out-of-pocket costs. But remember, 5 years ago, under the original Obamacare, those people got zero subsidy under the program. Democrats are literally screaming, it's the end of the world if we go back to the Obamacare of 5 years ago. They're admitting implicitly that they haven't made healthcare more affordable. They've made it less affordable, and now they need even more subsidies to bail out their own failure. The middle class is not going to get hurt. By the way, even with the extra subsidies go away, 60% of people will be able to find a health plan that is $50 a month or less, so less than $2 a day. I think most people would say that's not a real pricey health insurance expense.
So, David, you say something. I know you want to respond. Then I
No,
got
no. I want to throw a couple things. First, let's do the global. What are the two things in our society over the last quarter century that have gone up the most in price? Healthcare and higher education. What are the two things that government stepped into the most in the last quarter century? Healthcare and higher education.
Yep.
Even though the ACA is only functionally 7% of the healthcare market, its distortive effects because it wasn't the way an insurance company benefits is actually the bigger their book, the more retained profits they have. So the insurance companies aren't actually the bad guys. They just played with the rules, but the rules the Democrats designed were horrible. If you actually care about the price of healthcare, I beg of you, start caring about the price of the services and the procedures and with the pharmaceuticals and everything else that go into being healthy. The way we do it when we fixate on just sending cash out the door, we've distorted and raised the price dramatically. And you can actually see it in the healthcare inflation, particularly in subsidized plans, being dramatically more expensive than even the cash pay world. So you see the distortive effects. So if our goal here is to help our society be healthier at an affordable price, you cannot deliver it this way.
So if you're listening on the app, because we are on video, but app, we're having our first 2026 healthcare summit with Dean Clancy from America for Prosperity and our friend David Schweikert, Ways and Means Committee, senior member of Ways and Means. The question
Is that you saying I'm old?
When I have guys like Dean on, when they say they're a junior fellow, I say, they're a senior. Are there any junior fellows if you're a senior fellow? And there's never a junior fellow, is what I've learned. But here's on the politics of this, right? So, David Schweikert, you've said that you have sponsored, 2 to 3 different Medicare bills.
Oh, we have a dozen look,
But you said you can't
and
find
then I've got,
you
and
can't find ghost.
because Dean actually has some of the more interesting things here. But we have everything from Medicare Part C, which is Medicare Advantage. We have report after report after report, these MedPAC reports that basically show the misalignment and almost a couple $1 trillion of misalignment over 10 years, making it the single biggest. So we just wanted to put it back to,
What does misalignment mean? Explain
it
that.
basically means you make more money by scoring your population sicker than making more money by helping your population be healthier. It's
Got it.
it's that simple.
Okay.
We've tried to legalize technology, saying if I want to wear the data ring, if you want to actually have the flu kazoo at home, the things allowing AI and these things in your life, if you want to allow it to prescribe, if that's what you choose to do, but that's illegal. So it's more than just HSAs and empowering you as an individual to choose. We also need to empower you the technology you wish to choose.
Well, the reason I bring this up, right, is that Medicare, of course, is such a political hot football, right? That's why no one wants to touch Medicare reform. Is that same fear in Obamacare reform? When the rubber meets the road, no matter how much fraud you guys are both digging up in Obamacare and the broken system of money going directly to the insurers. I've got the senator who's the former physician guy, Republican. He used the word ghost patients in an interview Sunday, right? Dean can probably tell me who that is, but what's the political will of the Republicans to? I mean, how many people are going to jump off the fence on this one going into the midterms? We'll start with David and then go to Dean, but because David's.
I'm going to actually let Dean answer this one because I get. I look. 2 weeks ago, we did a presentation of our analysis paper on these subsidies on top of the subsidies, and I was shocked how many Republicans I had who were unhappy that we told the truth about the math.
So Dean, he's thrown the football over to you.
Yeah. That's what I get for not being a congressman. Yeah. The congressman is right. There is a division among Republicans. Some of them really would like to see the extra subsidies get extended. That's political. Nobody has a good policy reason to do it. But they're worried about how voters might perceive it. And our view is that it's not the end of the world if these extra subsidies from COVID go away. We'll just be at Obamacare of 5 years ago. More importantly, we all recognize now Obamacare has failed. It needs to be repaired. Healthcare needs to be repaired. And the good news is Republicans, who are always accused of having no plans, actually have very good ideas. I've got a spreadsheet. I must have 150 lines in it, including some bills, I'm pretty sure by Congressman Schweikert. I can't remember exactly, but lots of good bills. And the Ways and Means Committee that he sits on has passed a bunch of great bills. Some of them, one of them made it into law as part of the one big bill in July. It expanded health savings accounts to 10 million more Americans. It expanded direct primary care access. That's where you pay a monthly subscription to your favorite doctors with no insurance company middleman. So there's hope here. Congress just has to do it. Republicans just have to move these good ideas through and get them signed into law, or at least have a debate with Democrats publicly about these issues. When they do that, no one will be able to say they don't have a plan. The debate will be about whose plan is better. Who do you trust in healthcare? Your doctor or the government? Your doctor or a big health insurance company? That's a great debate to have.
So our friend Xtina in the live chat said that hers, because of the lack of subsidies, are now going up $3,000 a year for two people. So her take, I think it's her, Tina, just continue the subsidies until you can figure it out. So what do you tell someone like her who's now looking at a $3,000 bump in her healthcare costs on what's the help coming on the way and what's a timing of what this could look like? Dave?
We need to, I'm going to hop on this one. We need to help Tina look at other options in the market. Remember, we're only talking a sliver. Is she using a broker? How is she finding her healthcare options? Because one of the things we have succeeded on the Republican side is we've added other options. Is she being presented those? We
Right.
went through that with one of our family businesses right now, where they were on an ACA subsidized plan. We found something that's actually outside the ACA market that was actually much better priced and actually had the network they actually wanted. So it's going to require a little bit of shopping, but I think she will find a better alternative.
And again, are
Yeah, and
any
if I could,
sorry, go Dean. I'm sorry.
I
Go.
was just going to jump in. I was going to say, somebody who sees that big a jump is probably making more than $90,000 a year. They weren't eligible 5 years ago. They got lucky. COVID came along and Congress bloated up Obamacare, and now that's going away. So, what are the options? The Congress mentioned some. There's also short term health insurance plans. Republicans have proposals to create association health plans. Rand Paul's got a great bill on that. So, you could get your
Mhm.
health insurance through Walmart, Amazon. It would be much less expensive. Um, and of course, a lot of the folks who are in that group that are going to see the large increase. This is, by the way, that's only 7% of the 7% that the congressman is talking about. So it's a sliver of a sliver, very few people. But for them, oftentimes they are eligible for workplace coverage. Well, they're not going to be eligible for Medicaid or something like that. But the point is, there probably are options, and certainly Congress should be creating more options so that people don't get stuck in the crack.
So my
If I can, I want to throw you the absurdity, and it was a very small population, but it's an example. Um, we we did some data mining. We had a number of people in Maricopa County that were making over $400,000 that were still receiving subsidies here.
wow.
So you start to think about how distortive this is, and and there's this hunger to just keep throwing money at it and keep the distortion going, and you end up in this doom spiral if we keep doing this.
All right. So my last question in the impromptu healthcare subject is, what ideas coming from the Republican side that we're talking about can get to 60 votes in a thing called a dysfunctional place called the U.S. Senate? Either of you guys, what do you got for me?
I'm going to let Dean throw it because I actually think some of the ideas, even Rand's ideas, which many of us are big fans of adding other competition into the insurance market. I don't know why Democrats, particularly a rational Democrat, would oppose these things. Dean, what do you think?
I totally agree, Congressman. There's no reason why they would oppose it unless their real motive is political and ideological. They just want the government to be in charge. And if we keep allowing these little, poking these little holes in the Berlin Wall, little places where people can escape to freedom, they're not going to go along with that. So I'm going to tell you, Chris, I think you won't get Democratic support for any Republican health proposal in the Senate. I do think they should be put on the spot. They should be forced to vote on ideas like health savings accounts and association health plans and short-term health plans and direct primary care and reforms of the regulations that have driven up the cost of insurance and care and removing barriers so that you can open more hospitals and have more hospital beds. There's a whole list of things to do. I'd make them vote on all of those things, and then the American people can decide.
And Chris,
Yep.
if you go back to a conversation you and I had a couple of weeks ago, my frustration, one of the reasons, leaving Congress and running for governor is we had a promise of doing a second reconciliation bill. And within that, we're going to be a number of the healthcare access spending technology reforms that we have model after model that says we can lower the actual underlying price. So I need you to think of this as an in and out game. How do I empower you as an individual to with HSAs and optionality and competition in the insurance side market? And then my other fixation is legalizing the very technologies and those things that actually lower the price of the actual services of healthcare. And teaming those up, we believe actually, we have one economic paper, we can lower the price of healthcare by a third by just legalizing some of the access and just in technology and putting that into a bill just like we did this summer, where you bypass the 60 votes, a reconciliation bill. So far, I'm not selling that idea. It got yanked out from underneath me, but maybe the pressure. And Dean, I need your help. We need to start pressuring our brothers and sisters here to step up and think big.
You got it.
Back to David. So the last thing on Tina, she says she's getting bumped $3,000 a month, and yes, she has a broker. Does that mean she needs to get a better broker? Yeah.
3,000 a month?
Yeah, that's something wrong in that number, because what's 3,000 times 12?
I know.
Yeah, yeah. So there's something wrong in that math.
All right. Well, Tina, I have a great health broker in Tucson called Phil Solinsky. Look him up, Solinsky. He's amazing. He'll help you. All right,
Hey.
gentlemen, you were fabulous today in our first impromptu health insurance, health care summit. I appreciate
And
it.
Dean, I apologize for crowding into, because in many ways you had the interesting stuff to share.
Oh, no, just the reverse. It was the honor to be on the air with you, Congressman.
Well, you guys got to come out. You guys got to come to bring Dean into some health geek conversations at the old office there. So that's what just got to happen. So
Oh, he would love some of one of the things is last year, the speaker, I think in some ways to get me to leave him alone a bit, allowed me to hire an additional PhD in healthcare statistics.
oh my Lord.
No, it's really important, because we have a bunch of members of Congress run around saying things that mathematically are untrue. And we got a lot of repair to do on the distortions that have been created. And gang, I got to leave you because we have a vote on.
Oh, I'm sick of your voting. So anyway, thank you, David. Thank you, Dean. God bless you guys. Dean, if I don't talk to you before Christmas, Merry Christmas. Happy New Year.
Likewise. Yeah,
All
you
right.
too.
That was amazing. Thank you. David, I'll see you next week. All right, let's go to break. 8:03, 10:03 Eastern. You're on Live the Dream Media, the first ever healthcare summit on the air here on Live the Dream. That was beautiful. That's why we do it. Tina, I'm going to pray for you. You're on Live the Dream Media Network.